reinforced aerated autoclave concrete. I've got that round the wrong way. Reinforced autoclave aerated concrete. It's a bit of a mouthful, so forgive me. So welcome to this session. I'm Jerry Donald, for those of you that I haven't met before. I'm Head of Property and Asset Development at NHS Grampian. I'm going to be assisted today by Graham Legg, who works within the Property and Asset Development team, and Emma Pettis from Corporate Comms. I was kind of expecting Jamie Donaldson from staff side to be on the call as well. Jamie may join us later. Janine, are you here representing Jamie today?
Yeah, unfortunately, Jamie's not well, so I am here today with Nicole, and I will also be there on Monday for Jamie.
Okay. Well, pass on our best wishes to Jamie for a speedy recovery. But Jamie is the staff side rep. It was appointed onto a coordination group that we have formed, and we'll say more of that in due course. So we really want to get to the questions that you've got, and any other questions that we've been asked via the Corporate Comms inbox. But I think perhaps just a little bit of background first of all on RAAC. So we'll give you a bit of background. You've probably read quite a bit of it already. We'll talk a little bit about the survey methodology. We'll talk a little bit about programme, and we'll pretty quickly get into the questions to give you an opportunity to ask anything that's concerning you at this point in time. So Graham Legg, can I ask Graham to come in to just give us a brief overview of what RAAC is? Graham.
Good morning, everybody. I'm sure you've all read about it, but RAAC, as Jerry says, reinforced autoclaved aerated concrete. It's a lightweight concrete that was used from the 1950s through to about mid-1990s. It was particularly less lightweight. It's reinforced. Sorry, there's a helicopter just going past. The last time we did this on Tuesday, there's helicopters going past at the same time, so my apologies for the noise. It'll be over in a second. Yes, it was a lightweight concrete that was used mostly in multi-storey buildings and flat roofs. It was cheaper and lighter, and therefore the structures, etc., that the buildings were required didn't need to be as robust, and therefore was cheaper overall. It was used in roof construction, wall construction, and in floor construction. But if it was used in any of the walls or floors, it was evidenced in the roof. It is a bit like an Aero. If you think of the Aero chocolate bar, that's the best way of looking at it. It's full of little air pockets, etc. And if water gets penetrated in that, it can travel through those air pockets easier, and therefore cause a bit of damage to that reinforcing that's within the concrete. It was widely used, not just in the public sector, but also in the private sector in areas as well for construction during that building phases. It is prone to damage, cracking, etc., and hence why we're taking forward some of the initiatives that are currently being looked at the moment. Right, enough for just now. Any questions about the material at all?
If there's anything concerning you as we go through the background to this, just put your hand up and we'll bring you in. So no hands up, so we'll move on to the survey methodology. So Graham will just tell you a little bit about the desktop exercise that we've gone through, and the survey stage that is coming up, and where we'll be focusing that survey on. So Graham, over to you.
Yes. Back in 2021, it was highlighted that there might be an issue with RAAC. There was some issues down in England, and there was a documentation came out from Health Facilities Scotland, now NHS Assure. And we did a desktop exercise looking at all our properties that were built between 1950s and the 1990s that had a flat roof construction and primarily more than 2 stories high. Subsequently, we narrowed that down and included single-storey buildings as well, because there was evidence of some of those buildings. In that desktop exercise, we pulled together that list, as did all the boards in Scotland. That went to HFS to pull that information together. Health Facility Scotland, or NHS Sure as they are at the moment, then took on board a specialist RAAC surveyor, because you can't really just tell by the age and looking at the material of what, if it's RAAC or not. You need the specialist surveyors to go in and have a look. So they were taken on board to do a look at a desktop exercise a little bit further than that, and with the intentions of carrying out physical surveys on site on the buildings that were identified. In Grampian, we've identified initially 53, which we've now increased to 54 separate buildings. These are not sites, but separate buildings, and a number of those are actually on the Forster Hill site. But there are in Aberdeen City and in Aberdeenshire, where we will carry out that further intrusive survey to confirm whether or not these buildings contain RAAC. Bearing in mind it is just a precautionary at this stage. We do not know which of these building sites do contain the RAAC, and that won't be confirmed until we've carried out that on-site survey. Okay. You're on mute, Cherry.
Apologies. So we're now going to work our way through a survey programme covering all NHS Scotland boards. That's being led, as Graham said, by NHS Scotland Assure. And the appointed contractor, Curry and Brown, will be coming to Grampian to have a look at our properties. We must emphasise that we do not know at this stage whether we have RAAC in these 54 buildings or not. However, we have 54 buildings that were built during the 50s and 90s that also have flat roof areas. So we will be, as a precaution, surveying all those areas. I stress it's a precaution. I am sure we will find elements of RAAC. We've already found RAAC in the laboratory building, the link building between the Polwarth and East End ARI. And I'm pleased to have colleagues from the labs on the call today. So what came out of that was we had roof repairs. There was significant water ingress coming into the top roof of the labs building. We were preparing to repair the roof when we thought we might well have RAAC on the roof. We've had 2 survey reports, one by a local company and one by the nationally appointed company by NHS Scotland Assure. Both have confirmed that we've got RAAC. Both are coming up with similar findings, that the RAAC is in a safe condition, and that we will continue to repair and replace the roof, albeit with a concession that we will have an annual review of the condition of the RAAC, just to ensure that we are satisfied that the integrity remains safe for the building to continue in occupation. So that's a multi-storey building. It's the roof area. It's the roof areas that we'll be focusing in on in the other 53 buildings that we'll be going to visit. I can't give you dates and times when we'll be visiting those at this stage, because we haven't had that programme confirmed yet by NHS Scotland Assure. What I can tell you is that we have formed a coordination group in Grampian. I myself chair that group. We've got staff side on it. We've got estates, facilities, IPCT and contingency planning. So we've had a look at the 53 buildings that we yet need to survey. And again, by way of desktop exercise, to identify the priority way in which we want these buildings surveyed. So we've given a scoring matrix of 1 to 4, 1 for key clinical areas, 2, Graham, you'll need to help me with this, 2 with other clinical areas,
patient areas,
that have inpatient beds, 3 for office type accommodation, and 4 for ancillary support accommodations such as a housing for a generator and that sort of thing. So we will be asking the team when they come to Grampian to focus on primarily those inpatient areas, and the likes of theatres are all the high risk areas we want surveyed first. So that will be the way that we would like the programme conducted. We've yet to speak to Curry and Brown about that, and as I say, we've yet to get a date from Curry and Brown when they will be coming to Grampian. But as soon as we get that, we will communicate that further to you. It's probably worth stating as well that Grampian has the highest number of buildings out of the 254, and the list is growing nationally that boards want surveyed. Again, we do not know if these buildings contain RAAC. The whole purpose of the survey is to identify whether it is RAAC, and if it is it safe? So that's what we want to do, and identify any remedial action that needs to happen thereafter. Some of the questions that we've been asked so far are we going to have to vacate to allow these surveys to be undertaken? The answer is no. There may be areas that might be isolated out of use to allow the surveys to be undertaken, and to do that safely under infection prevention control guidance. But that will be in conjunction with the department that occupies that area, and we would want to minimise as far as we possibly could any impact on service delivery. So the focus will be on roof areas first. So if you're in the top floor of a building, we will be coming to that area if you've got a flat roof and it was built during the 50s to the 90s. If we find RAAC there, we will be carrying out investigative surveys throughout the rest of the building just to see if there's any wall panels or floor slabs that are made of this RAAC material. Expectation we have in the majority of instances, if RAAC is identified, it will be on the roof. So 254 buildings nationally, that list is growing. We've identified 54 in Grampian. It is very much precautionary. We want to be sure, and we want to be satisfied that if RAAC does exist, that it's safe for you to continue an occupation of your area. So the coordination group will continue to meet. One of the things that we are asking all services to do that are affected in those 54 buildings is to develop a contingency plan. Now, you may well have a contingency plan for your department already, but I doubt whether that contingency plan talks about taking the top floor out of a building, which is one of the asks. And the second ask is, what if you have to vacate the building? So we're really looking for your support in terms of developing those contingency plans for those 54 buildings. And George King and colleagues in labs are already working on that. Tara, do you want to come in at this stage and say a little bit more about expectations generally for civil contingencies?
Thanks, Jerry. Yeah, I was just a way to type in that, you know, the Civil Contingencies Unit and all the advisors out in the Shire and Moray, etc., are here to help with anyone who is needing a bit of support around this. Obviously, the key thing is to make sure that you've got an up-to-date business impact analysis, so that we know the criticality of the services within that building, and then looking at the contingency plans so that we can help support with where might be possible to move out to should work be required, like Jerry says, if RAAC is found. So more than happy to help. Can have one-to-one conversations, can have group conversations if you want to gather people if they're all in the same building, but please just reach out to the Civil Contingencies Unit and we'll help support wherever we can. Thanks.
Wonderful, Tara, thank you. So I think that's pretty much taken us into the question zone. So feel free to put your hand up and ask any questions. Maybe to kick the ball off, Emma, I think we've got 1 or 2 questions that you've got that you would like to ask of us, and but feel free to put your hand up and we'll bring you in just as soon as we can. Emma.
Thanks, Jerry. Yeah, so a couple of the questions that have come into us have really been people just looking to be very clear about areas of buildings. We know the list that went out contains sort of building codes, which if you're in and about the building side of things, you know exactly what these codes mean, but you may not be clear on what they mean, you know, more generally. So the three areas we've been asked about is Fraserburgh Hospital, where it's listed as Area 310C. A little bit of clarity on the areas in Dr. Gray's hospital. Now, we've listed the mortuary there, but this is about specifically the areas within the hospital, and a little bit of clarity about the areas affected where we've listed Argyle House, Aberdeen Dental School. So if I can turn that over to yourself, Jerry, and to Graham, just to clarify those areas.
Perfect, perfect. So I am going to come to Graham to help me with the detail around most of that. Graham, do you want to kick off with Argyle House? Is probably straightforward to answer. You want to pick that one up first?
The dental school is made up of 3 different blocks within there. You've got the dental school itself, you have the dental practice area, and you've got Argyle House, and it's Argyle House which was original part of the children's hospital that's of concern, not of concern, but an area that we're going to investigate further. The other 2 parts of the building were newer, and we don't suspect and will not have RAAC in them at all. It is the Argyle one.
So it is Argyle House, and I think the inquirer of that was asking, is it the area that we occupy? Yes, it is, but the focus will be on the top floor of the building. So from the floor plans that they provided, Emma, highlighting the area they occupied, I'm suspecting their ground floor and first floor. We've got 3 stories in Argyle House, so it's the top floor that we'll be looking at first, and only if we find RAAC there, we'll be looking at the other areas in the building. Graham, I think the second one was Dr. Gray's and the areas that we'd be looking at Dr. Gray's.
The areas of Dr. Gray's in particular is the mortuary. I think the area in concern that the question was what's currently Ward 7 and what was the old GAU, Geriatric Assessment Unit, and Physio. So again, it would be that building in its entirety. It's a 2-storey building, flat roofed, concrete, that we just need to investigate in there. So there is an area in there we need to check out. But it's that area there. It's Ward 7 and that entire building.
So the mortuary will work that one through at Gray's with the service. Indeed, Ward 7 may have will have us in that area investigating the roof, because they're on the top floor of that 2-storey building. So again, similar to Argyle House, if we find RAAC on that roof area of Ward 7, then only then would we be looking at the rest of that building. And the final one, Emma, I think was Area 310C at Fraserburgh Hospital. Just a bit of clarity around that, Graham, in terms of what area are we going to be looking at. There was a bit of confusion whether indeed this included the Saltoun medical practice.
Yes.
I think we can safely say it does not include Saltoun practice, but could you maybe just clarify that and the area we're going to be looking at?
Yeah, I'm afraid it's our coding structure that we have. It's a national coding structure that we have inherited and have stuck with, and it's raised some concerns I need to go and have a look at. But the area of concern we're looking at is the flat roof building. It was the old clinic at Fraserburgh Hospital. It's now occupied by maternity, and I think physio have got a little part in that area. It used to be a self-contained part of the building. It's now opened up into the main part of the hospital. But the coding structure that was there originally hasn't changed nationally. It's just something I will look at. But it's that area, what I would call to the rear of the hospital, which was the old clinic area, that we will check out there for RAAC.
So I think the inquirer there can be satisfied that their assumption was correct, and it's not the Saltoun medical practice. It is not affected by this survey. Okay, I'm not seeing any hands going up. Doreen, in you come.
Yeah, sorry, Jerry and Graham. I just a couple of questions. Excuse my ignorance on this. So if it's not in the roof, you wouldn't think it would be anywhere else in that floor or the floors below. Is that correct from what you've been saying?
That's correct.
That is correct, Doreen.
Okay, so if they don't find the roof, they wouldn't be checking other bits of the building or anything like that.
So because it was a lightweight building material and a cheaper type of material, the areas that predominantly it's been used in, not only, but predominantly is the roof.
Okay.
And we're the advice that we've been given is if it's not in the roof place, it will not, sorry, the roof space, it will not be anywhere else in the building.
Okay, thank you. The other one was to just ask again, for when did it originally, when was the first kind of idea that there was something maybe wrong with using RAAC? You know, like I know it was 2021 that the survey was done, but do you know when the government, the Scottish government or whoever were made aware originally of the actual problem with RAAC, or is it something that everybody's known about for years but just hoped it wouldn't happen?
So the problem arose down in England in Kent in 2018, where I think it was a primary school over the weekend, thankfully, with nobody in the building, had a roof collapse. You know, Graham has described where we've got water ingress, it's going to soften the integrity of those planks, where perhaps they've not been completely sealed and when they've been manufactured, there may be issues there. So unless we survey these, we don't know if they're there. Unless we survey them, we don't know the condition that they're in if they do exist. And if they do exist, we then need to decide what remedial action we need to take. And I'm hoping that if we do find more RAAC, which I do anticipate we'll find, that the situation will be no different than that which the labs find themselves in. There are situations down in England whereby they have roof areas being physically propped up at the moment and awaiting an outcome as to what they're going to do with that building. And I think NHS England have announced that they will be rebuilding 5 hospitals that contain RAAC or RAAC is a risk within them.
Yeah, no, I'd seen that. Yeah, thank you very much. Thank you.
You're welcome. Gillian, in you come.
Hi, so I'm Gillian. I'm Area Support Manager at Fraserburgh Hospital. So we're obviously listed quite a way through that list. Thank you for clarifying the bit about the health clinic through the back. I'd gone into states about yesterday as well, so thank you for that. It was just really to say that we do have quite a lot of issues with water coming in. So I think I'm just going to be I'm going to try and be optimistic here, but I dare say we might be one of the ones that's going to come out with something out of the survey here. I am still working on our business continuity plan, being in contact with Jason Shirazi as well, so we're still working on that. I'll obviously bear that bits in mind after Tara saying that if we did need to come sort of vacate one of the bits of the building, then, but just to thank you for clarifying that bit for us, really.
Not at all, Julian, and we're hoping for the best, but we're planning for the worst. And your support around your continuity plan will help us incredibly with that.
Yeah, sure. Thank you.
Okay. Any other questions? If you don't want to put your hand up and ask a question, please pop it into the chat and we'll deal with it that way. Mary, in you come.
Sorry, I missed the start of the meeting, so it may have been answered, but is there a timescale for the survey when it would start?
Unfortunately, I'm not able to give you that at this stage because this is a piece of work that's been commissioned nationally by NHS Scotland Assure. So they are developing a programme for the whole of Scotland. And just as soon as we are aware when they come to Grampian, we will make all the occupiers of those 54 buildings aware. And we have decided in Grampian through the coordination group that we've set up to prioritise our surveys on the high risk and inpatient areas. So if you're in a theatre area or an inpatient ward area, those are the doors that we'll be knocking on first to get the surveys undertaken. But just as soon as we have clarity nationally from NHS Scotland Assure, and we've had that detailed discussion with Curry and Brown about how they're going to approach our methodology of prioritisation, we'll let you know when you're likely to have that survey carried out in your building.
Okay, thank you.
Emma, and then Graham.
I will yield to Graham because I think he's probably going to come in with a bit of information on that point.
Okay, Graham.
There may well be some work prior to those surveys for your information. There could be an asbestos survey if we don't already have that information in that roof space, because we need to do that prior to the surveyors coming along. And also we have to do some preparatory work in some instances by cutting some hatches into those roof spaces where there is a plasterboard ceiling, etc. So although we don't have the exact date of the surveys are coming along, we will be doing some preliminary work, in which case you will see some staff and surveyors on site, but that's not necessarily doing that RAAC, so we will let you know prior to that happening. Okay.
Janine?
Thank you, Jerry. It's more a comment for Emma, really, from a comms point of view. I understand the logic behind, you know, sort of looking at the high risk areas that you've identified in terms of inpatients and such like. I guess it's just making sure that staff don't feel that those are the focus, that they're equally valued within the buildings that they're in, and you know the concern is equally for them and their well-being, and just to make sure the two kind of sit alongside each other. As I say, completely get where you're coming from. It's just making sure that that message is there. Is that okay?
Absolutely perfect, Janine.
Thank you.
And understood. You know, all our services are valued, but some of the areas are higher risk than others.
Yeah.
But you're absolutely right. We need to be careful about how we convey that message.
Thank you.
Yeah.
Thank you for understanding that.
Emma.
I think it's a point really well made, Janine. And I think I also just, it kind of ties in quite nicely with why I'd originally put my hand up, which is after the session that we'd had on Tuesday, one person got in touch to say, I'm an area manager in this area. I've read everything. Our building isn't listed. Do I need to do anything else? To which my response is no, in terms of RAAC, you don't. But we encourage everybody, obviously, always to keep an eye on their buildings and to report any issues, because that way estates and facilities can be alive to any problems and get them resolved as quickly as possible. And that's just good practice for all of us, wherever we work, regardless of the age of the building.
Really helpful. Thanks, Janine. Any other questions? George, and you come.
So I would agree with what Emma said there. The early inspection of laboratories happened because we used the estates and DATEX systems for reporting water leaks within the building. So you don't ignore water leaks in your building, just please report them.
Thank you. Thank you for that. So we're kind of beginning to dry up a little bit with questions. I'm assuming, perhaps wrongly, but you can tell me otherwise, that if there are no questions, we've covered the points of concern that you may have. We will continue to engage with the occupiers of those buildings. I think it's really important that we get those messages out, and as Janine was saying, in an appropriate manner that doesn't make anybody feel undervalued. We will do that, and we'll be in contact with you and your building just as soon as we have that agreed programme from Curry and Brown. Any final questions? Emma, are we going to be putting this out in the brief again today that we've had this? I just wonder if we are, whether indeed there's any merit in putting a link into civil contingencies, how to contact them should anybody wish support with a business continuity plan.
So what I will do, and as I did on Tuesday, I've been updating the FAQ. I've been making notes as we've gone along. So an updated version of that will go out tonight, along with a link to the recording of this. For people's information, what I do is I download it and I add it to YouTube. It's a lot easier to do because otherwise I get lots of messages asking for people to get access via Microsoft Office 365. It's just easier that way. So that will go out tonight. So please share that with colleagues who haven't had a chance to attend. It's there for anybody to view. And I think just yeah, keep asking questions and keeping us apprised of what's happening, and we will keep updating the FAQ as we get more information.
Lovely. Is that us for this session? This is the last session we've got planned. If colleagues feel that there is a need for another session, we're more than happy to do it. So come back through corporate comms. If we need to do more of this, we're happy to do it. It's important we get the right messages conveyed to you, and sometimes the best way to do that is just to talk it through as opposed to a written communication. So if there are no other questions, thank you for your time today. Thank you for your interest, and I hope the rest of your day is a good day. Thank you very much.
Thank you. Bye-bye.